Are you dealing with knee pain? Do you still want to work out your legs without putting stress on your knee joint? Today we're going to show you a group of exercises that will allow you to train your lower extremity without putting pressure on that knee. Hi, I'm Daniel Giordano, Doctor of Physical Therapy from Bespoke Treatments. Today we're going to show you a group of exercises that will allow you to train through your knee injury while working your lower body and keeping you in shape during that time. Before we start with this group of exercises, we want to make sure that you know how to do one thing, that's hip hinging, okay? Von's going to show us how to hip hinge. He's going to shoot the hips back, initiate the movement from the hips. Once we can transfer that mechanical stress to the hips, it will allow to take pressure off the knee while moving the body. So he's going to start with a lateral band stepping. He's going to step out to the side and back in. At this, you can tell that he's not moving this side because we're putting the stress on the stable side, trying to activate that glute medius muscle to take pressure off of the knees. The stronger the glute medius muscle as the hip is, the stronger you're going to be proximally to take pressure off your knee distally. 8 to 12 repetitions on each side to get those glutes fired up and taking pressure off of your knees so that we can get back to putting pressure on your knees. The second exercise we're gonna do is a standing fire hydrant move. So Von's gonna bend his heel towards his glute, keep that leg stable, and he's gonna start lifting out to the side, okay? So what we're doing here is we're working the glute medius muscle again, and those glute muscles to take pressure off the knees. I'm saying it twice, but the stronger we get those glutes, the less pressure there will be on the knees and allow us to heal proximally and strengthen proximally as we allow the mechanical stress to come off the knee. He's gonna do 8 to 12 repetitions on each side, getting those glutes to fire off before we move on to the next weighted exercise. Third exercise in this group of exercises, we're gonna start loading the weight. So now that we have those hips fired up with those banded movements, now we're gonna start doing a loaded step up in the goblet position, okay? So key on this is he's gonna focus on pushing through his heel, not through the forefoot. So we're gonna lock that heel down, go straight up, step up, tap, and then slowly come back down, okay? So one thing that Von's making sure he's doing is not transferring the pressure forward on the knee because we want to keep the mechanical stress in the hip right now before we start to reload the knee. 8 to 12 repetitions on each side, but remember, when you're getting up, feel that contraction through the glutes and then slowly come back down. Fourth exercise we're gonna do is the reverse lunge in the goblet position. So Von's gonna make sure that he's still initiating from those hips because we want the pressure to be in the glute, okay, not in the quad. So he's gonna step back, press through that front foot and then up. One of the common mistakes that I see is people start to push through the back foot. We don't want that to happen, okay? We wanna step back into that reverse lunge and push up through this heel, activating the glute on that side. Stronger glutes, less pressure on the knees. 8 to 12 reps on each side and hyper focus on pushing through that heel of that front foot as you come up. This is the fifth and final exercise that you can do to strengthen your hips while you have that knee injury. He's gonna start with a goblet squat, heels elevated, okay? So initiating from the hips, so back and then down, keeping that chest up, core tight. What he's doing is initiating from the hips so the load stays on the glutes and we're strengthening through those glutes. Some of you might ask, why the elevated heels? Because we wanna decrease the activity in the calf muscle so there's less pressure on the knee. As that knee starts to heal, we'll put those heels to the ground and start working a little more forward to put more pressure and mechanical stress on that knee as your knee starts to heal. But in the beginning phase, remember, initiating from the hips, down and back, heels elevated, less activity on the calves, less pressure on the knee, 8 to 12 reps on each side. Those 5 exercises are a great way to train through a knee injury. Remember, we're loading the hips, strengthening the glutes, and then offloading the knee. Once we feel better, then we'll reload that knee and gradually increase the pressure and mechanical stress into the knee. But remember, in the beginning, let's take the mechanical stress, put it in the hips, strengthen the glutes so you can train through that knee injury.